Hi, a lot of our viewers are planning pregnancy, but because of the cycle irregularity, many a times we get this query that how do we exactly know what are our fertile days? Are there any signs and symptoms or some aids by which we can calculate our fertile window, find out the ovulation date, and try in that period for maximum chances of conception? So let's understand how can somebody calculate the ovulation day. For us to know this, we should know what is exactly happening inside the ovary. A female will have two ovaries, mostly right and left. Now, either of them will make an egg every month, either the right side or the left side. How is the egg formed? So first, when you see your periods, let's take as the first day of bleeding day one, and that is what is also called the last menstrual period or the day one of the cycle. To understand this, let's pick up a date. Suppose it is 15th of April. Now, if 15th of April is your LMP or day one of the cycle, we on an ultrasound would see small little tiny follicle in the ovary. Now, usually a ovary would have multiple follicles in it, but it is only one follicle that will grow in a cycle. Now, this particular follicle, as it starts to grow from the day 2, day 3 of your cycle, it would reach the maximum size of somewhere around 18 to 20 in the middle of the cycle. So, for a woman who has a 28-day cycle, this particular phenomena will happen on the 13th day. And on the 14th day, this particular follicle will release all its fluid along with the egg. And this egg is then picked up by the fallopian tubes. Now, fallopian tube are nothing but a conduit that connects the ovary with the uterus. The fallopian tube will pick up the egg and the egg will stay there for 12 to 24 hours, after which it undergoes disintegration. It gets destroyed in the body. Because of intercourse, the semen is deposited in the vagina. So this is the part where intercourse is happening and sperms are getting deposited. Only good motile sperms would travel all the way to the egg, cause the fusion, make the embryo, and now this embryo will grow for around 4 days inside the tube before it makes a blastocyst that attaches on the lining of the uterus, which is the 5th day stage for pregnancy to happen. Now, if we see this in an ovary, this particular ultrasound will show the growth of this one follicle that is going to contain the egg and release the egg at the time of ovulation. Now, this particular process of ovulation is easy to calculate if the cycles are regular. So, for example, if this woman had a 28-day cycle, her ovulation day would have been minus 14. That makes it the 14th day of the cycle. From 15th April, that will come out to be 28th of April. Then for women who has a 30-day regular cycle, if we want to calculate the ovulation day, we subtract 14 and that makes it 16. So 16th day from your last menstrual period, and in this example from 15th, it is going to be 30th of April as the ovulation day. Now this is easier. For 35 day, it is going to be again minus 14, 21st day of the cycle. Right? That will make it 5th of May. Now it becomes easier if you have a cyclical pattern. But for somebody who doesn't know, who really can't predict, so a couple comes to me and the female tells me it can vary, doctor, between 35 to 45 days. Now when that is the window, it is very difficult for you to calculate the precise day of ovulation. Now, why is there so much emphasis on ovulation day? It is because we understand that ovulation causes the release of the egg. Now, once the egg is released, it is fertilizable for only 12 to 24 hours inside the female body. Similarly, talking of sperms, Once they are deposited in the vagina, they are viable for 2 to 3 days. Now, if somebody wants to plan a pregnancy, this timing is important. So say suppose you had intercourse 4 days prior to your ovulation, it is highly likely that by the time ovulation happens, there would be no viable sperm. So, this particular window, that is around 4 days prior to ovulation and 1 day ovulation after, is defined as the fertile window. A woman, if she can determine the fertile window of her cycle, she can maximize her chances of pregnancy by having intercourse during this time period. Now, looking at the viability, it is advised that having alternate day intercourse is adequate for the pregnancy chance. For this particular woman who had a 30-day cycle and her ovulation was on 30th April, if we have to calculate the fertile window, I'll tell her that you should have intercourse alternate day from 27 till 1st of May. That is likely the fertile window during which, if intercourse happens, the chances of pregnancy are going to be maximum. So for such women, a very vague idea they can get by subtracting around 20 from the shortest cycle and 10 from the longest cycle. So for 35 minus 20 will come out to be 15, and subtracting 10 from the longest cycle, which is 45, it becomes 35. So she has a very broad or a vague thing that she has to have intercourse for that big window. To particularly make it very precise, we have some aids, we have some signs and symptoms that can help you to determine your phase of ovulation. As ovulation happens, from the start of the cycle, when the follicle is small, it grows and assumes a size of around 18-20 mm before ovulation. There is a hormone in the body that is called estradiol that rises. This is the female hormone that also causes the growth of the uterine lining for the embryo or the pregnancy to happen and nurture the early part of the pregnancy. Now, before rupture, before the release of egg, before ovulation, another hormone that rises in the body is the LH hormone. Now, once this hormone rises, it causes the follicle to break and release the egg. Now, these two hormones have important roles to play in our body. This is the hormone that causes the increase in the sexual drive during the fertile window. Also, this hormone would cause your vaginal secretions to become more fluidy. So, if you have a cycle that started on, say, around 15th April, mostly after the periods of 4-5 days, there is no vaginal discharge or there is very minimal discharge. But this vaginal discharge starts to become fluidy and sticky and mostly transparent. That happens maximally when the follicle has assumed the biggest size pre-rupture. So these effects happen because of estrogen hormone. And once in the body, ovulation has happened because of LH hormone, a different hormone which is called the progesterone or the pregnancy supporting hormone rises. Now this progesterone hormone will cause the fluidy character of the vaginal secretions to go away and you will have thick white discharge. This cyclical pattern of discharge is absolutely normal in a female. And also this hormone will cause the rise of basal body temperature. So if your temperature was somewhere around 36 every day, after the ovulation, it is likely to rise by around 0.5 Celsius. So these are the basic cues that help you to identify your fertile window. If I have to enumerate, I can put it: increased sexual drive, your secretions, basal temperature, and we can also quantify these hormones by means of kits that are available. So ovulation kits, these are just like pregnancy kits. And in a 28-day cycle, we advise our couples to start using them from the 10th day of the cycle. And the ovulation kit would initially show you a negative line, and later, as the hormone rises, the kits will start to show you faint positive to dark positive line. Now, mostly the release of egg would happen in the subsequent 24 hours. So if you see an ovulation kit positive sequentially, the first kit has to be negative. It is high likelihood that your egg is going to be released in the next day. So you should have intercourse that day and the subsequent day. Also, there are certain kits that quantify both the hormones together, so estradiol and LH hormones, and they come also as ovulation kit. If we have to go by more cumbersome means, it is an ultrasound. So, ultrasound follicle monitoring right from the start of the cycle will give us an idea of not only of the growth of the follicle that is containing the egg, but also the uterine lining, because the uterine lining to begin with at the time of periods is all shed, and it then starts to remake under the effect of estradiol hormone, coming out to be of maximal thickness at the time of ovulation. So an ultrasound will give us an idea about both the follicle growth, the ovulation, and the endometrial thickness of the uterine lining. Blood test of serum progesterone can help us to know in retrospect whether the ovulation happened or not, because this hormone was released after the ovulation. So if we get a blood test done for serum progesterone, it will tell us whether ovulation happened. So these are the things, these are certain signs and symptoms, and these are certain blood tests, ultrasounds that can help you to find out your ovulation date. For women in whom the cycles are irregular, or this particular formula of subtracting 10 and 20 is not working, in then I would advise that you should seek a fertility specialist soon, because in that scenario probably you would need certain medicines so that you can have ovulation on the right time, and the ovulation needs to be tracked for you by means of these modalities so that you can identify your fertile window and try adequately during that time for maximum chances of conception. If you have any more doubts related to ovulation day, you can comment us in the comment section below. If you want to book a detailed consultation about some specific reports or history of yours, these are a WhatsApp number where you can connect with us. Thank you so much.